Switch on your mic, Ranjani.
Good evening, sir. My topic for today is newer insulins. Newer insulins are developed through genetic engineering, and the newer insulins are classified as short-acting insulin and long-acting insulin. The short-acting insulin are insulin Lispro, otherwise the brand name is Humalog, and insulin Aspart, also known as Novolog, and insulin Glulisin, otherwise known as Apidra. And long-acting insulin analogs are insulin Glargine, also known as Lantus, insulin Detimer, also known as Levemir, insulin Degludec, also known as Tresiba. These advantages of newer insulin are they have a faster onset and offset of action and improved glycemic control and flexible timing, fewer injection site effects, and they have more predictable effects, and they have less variability in absorption, and they have increased stability, and they have a selective action and helps in developing individualized treatment suitable for the specific patient characteristics. Newer insulin analogs are faster acting preprandial insulin analogs or longer acting basal insulins, which provide a constant concentration with no peak increase in insulin level. They act as monomers and are absorbed much faster as like Lispro and Aspart, or absorbed very slowly, also which are known as Glargine and Detrimer. This Glargine and Detrimer they show a steady release of insulin and should be given at the same day every day for a consistent control of blood glucose. And the B26 to 30 region of amino acid, it is the very critical site for insulin receptor recognition, and it is the site preferred for structural alteration and the aim to modify the pharmacokinetic profile of the insulin molecule. And regarding short-acting analogs, the insulin Lispro, it is created by inversion of the proline and lysine amino acid at the position of 28 and 29 of B chain, which results in rapid absorption and shorter duration of action and faster onset compared with the regular insulin. This modification did not alter the receptor binding, but it blocks the formation of the insulin hexamer and dimer. This allowed large amount of active monomeric insulin to be available for after meal injections or postprandial injection. It acts within 15 minutes, which is so rapid, and it can be used in patients with type 1 diabetes without compromising the blood glucose control. And insulin Lispro causes less postprandial rise in serum glucose level, and HbA1c, that is glycosylated hemoglobin, is less, and it also causes less incidence of hypoglycemia. And it is also effective as regular insulin, and in pregnancy there are no teratogenic effects noted. And insulin Aspart, it is created by recombinant DNA technology by substitution of amino acid proline at position 28 with aspartic acid. This prevents the formation of hexamers, and which results in rapid absorption from the subcutaneous tissue, which results in better glycemic control. Regarding insulin Glulisin, it is formed by substitution of asparagine at position B3 by the lysine at position 29 by the glutamine amino acid. It exerts its action by causing insulin receptor phosphorylation. It also has anti-apoptotic activity. Due to its action, it counteracts the lipotoxicity and autoimmune-induced alpha cell destruction. And insulin Glulisin carries the risk of tumorigenicity due to this substitution at position 28 to 30. And regarding long-acting insulins, they are ideal basal insulin which has longer duration of action and provides 24-hour control with which should be given once a day. This long-acting insulin is developed based on the two approaches. By changing the insulin pH to neutral, it causes to precipitate in the subcutaneous tissue, which delays the absorption. And other approaches are by binding insulin to serum carrier with prolonged half-life, which delays its absorption. And regarding insulin Glargine, it need not to be mixed with any other insulin, as this insulin becomes cloudy, and it also results in alteration in pharmacodynamics and kinetics profile. And glycogen is developed by substituting asparagine residue with glycine at position 21 of a alpha chain and elongation of beta chain at the C terminus by addition of two arginine residues. And modification of this B chain causes this pH to shift from 5.4 to 6.7, which becomes less soluble at physiological pH and more soluble at acidic pH. This stabilizes the hexamer structure, which results in the delayed delivery from the subcutaneous depot and which maintains the stability in the acidic solution. This glycogen has a slow onset of action, which has a maximum peak effect at 4 to 6 hours, and its activity is maintained for 24 hours or more. And glycogen causes increased progression of retinopathy, and it causes more injection site pain, and it also has this increased mitogenic activity. And regarding insulin determer, it is formed by modifying insulin by binding to serum protein albumin, which prolongs the duration of action, which is created by amino acid threonine at B30 position is removed, and which is acetylated at 14 carbon fatty acid chain to lysine B29, which binds reversibly to albumin in plasma. And this insulin determer is the only biologically active form which slowly dissociates from albumin, which results in delayed action. Its onset is 1 to 2 hours, and its total duration of action is 24 hours. It should be given twice daily to obtain a smooth basal insulin level. And it also needs higher doses since it has lower affinity to the insulin receptor. And one advantage is that it causes a reduction in body weight due to its direct effect on the hypothalamus. And regarding insulin degludec, it is an ultra long acting basal insulin analog which has a duration of action of 42 hours, which is a modified insulin that has one single amino acid deleted in comparison to human insulin, and it is conjugated to hexadecanoic acid via the gamma glutamyl spacer at the amino acid lysine at position B29. Other forms of newer insulins are inhalation insulin, which is known as Alfreza, and other new insulins are Albulin, and other upcoming transdermal oral form of insulin and buccal forms of insulin and insulin pumps. Thank you.
Good. Okay. So, what is the need for that newer insulin compared to the older insulins like Restopane or
Older insulin have a slower onset of action, so, and they have variable sites of absorption.
often, and the blood glucose levels were
More
fluctuate.
hypoglycemia in the previous older insulins.
So these insulins were mainly done by modification of the amino acid sequence. Because as you know, what is the normal structure of your human insulin produced in the body? How many amino acid sequences or chains are there?
Totally around.
They have A chain and B chain, isn't it?
Yes, sir. Alpha chain.
There's an A chain with how many amino acids A chain has got and how many amino acids B chain has got. And how are they kept together?
They
If
are
you
kept
understand
together
the
by
structure of the normal insulin, then it will be easy to understand how the new insulins are created. They have 51 amino acids totally, 29 and 30, 54 or 51. So I'll just show you the pictures. And,